Thank you, Madam Chair, members of the committee. My name is Alan Prinsky. I'm a senior policy analyst for the Economic Progress Institute of Rhode Island. We seek to promote policies that help all Rhode Islanders pursue economic opportunity, but especially low and middle income Rhode Islanders. And we're here in favor of this bill, both as originally submitted and when the sub-A comes to fruition, we will support that as well. We do think much better that we should be on a path to 15. As our colleagues from the business committee said, they want a predictable path, and having us on a path to 15 with yearly increases would bring that predictability to businesses that are seeking that. They also said they would like studies, and they mentioned a little earlier, we've done some that kind of study. We have our Rhode Island Standard Need that we publish, and that shows that for the minimum wage today is not providing a living wage. Someone who's just a single person who's working, even like I think in 2018, would need $13 an hour just to barely make minimum, to barely for the basic necessities. An adult who's working full time with 2 children would need more than $30 an hour to afford that. And studies, if the minimum wage had kept up with the rate of productivity over the last half century, it would be about $20 right now. We also, in terms of the path, our neighbors in Connecticut and Massachusetts are already on that path. And so we are losing workers across the board to them. The second page of our testimony has a chart. You can see where we show the gap. Right now, we're minimum wage workers in Rhode Island are making $2.25 an hour less than their peers in Massachusetts. That's going to go to $3.75, $4.50 an hour if we don't take action on raising the minimum wage. And in terms of the, was raised before, the idea of the cost of living, maybe it's different in Rhode Island and other places. Even if that were to be the case, we can't really judge that on a state level. The workers are still going to cross the border, those who can, to be paid $2, $3, $4 an hour more for the same job. And also, we're probably using caregivers, workers in our caregiving community, to whether it's caregiving or other jobs where they can make more money just over the border. So it's important to be on the path for that. The studies that have been done show clearly that the minimum wage does not have a great impact either direction on employment. And these are studies, not just one kind of study. These are studies looking over decades at dozens and dozens of times when minimum wage has been raised, and they show very little, if any, impact. So I know it might seem like raising the minimum wage will bring this tie down, but the studies consistently do not show that. And then I would like to also point you to this handout we also gave out that it addresses the question that was said before that this affects a lot of teenagers. The truth is, the minimum wage workers, teenagers, are about 11% in Rhode Island. So a lot of people making minimum wage, like 50% work full time. For many people, this is how their family gets by, it's the wage for the family. And in terms of communities that are often left behind, so workers who are Black, Latino, women disproportionately benefit from raising the minimum wage. They're disproportionately represented in minimum wage positions. And the last thing I have to say is we heard talking about the health impacts of raising the minimum wage. And one of the new, fascinating, and these awful things that's come out, there have been 3 studies in the last year that have shown raising the minimum wage decreases suicide rates. It's a couple of, 1, 3, 5 percentage points. But the evidence seems to be that where minimum wage is increased, there's a slight decrease in suicide from some called deaths of despair. So increasing the minimum wage could have an impact actually to save lives. We support the path to 15 or any increase, and I'm happy to take questions.
Any questions? I just would like to add to the testimony that while a lot of teenagers are working at minimum wage, there are a lot of adults that are doing the same in order to survive.
Yes.
Thank you.